Okay, let's talk about something that so many of us experience but almost never talk about. Pain when you're using a tampon. It's a super common thing that often gets dismissed, but you know what? It's time we really dig into it. So here's the question that's probably on your mind. Is this just part of the deal? Is this pain something you're just supposed to accept as a normal part of having a period?
Well, I'm here to tell you that according to women's health experts, the answer is a huge, resounding no. It is absolutely not normal. Pain-free tampon use, that should be the standard, not some lucky exception.
Think of that pain as an important signal, kind of like an alert from your body. It's not something to just ignore or power through. So in this explainer, we're going to decode what your body might be trying to tell you using some amazing insights from top specialists in the field. First things first, we have to kind of shift our perspective here. Let's start with this really powerful idea. What if a tampon wasn't just a product? What if it was actually a diagnostic tool? This quote from the Women's Health Clinic just says it all, doesn't it? A tampon is more than a product. It's a diagnostic tool. Just thinking about it that way is a complete game changer and the first step to figuring out what's really going on. Okay, so if it's a tool, what could it be diagnosing? Well, the specific kind of pain you're feeling can actually point toward two very different but key underlying health conditions. Let's break them down. First up, there's something called vaginismus. Now, this one is all about the muscles. It's an involuntary spasm, and that word, involuntary, is so important. It's not something you're consciously doing. It's a reflex where your pelvic floor muscles tighten up, creating this sensation like everything is closing off. And then there's the second condition, called vestibulodynia. This is totally different. It has nothing to do with your muscles. This is all about your nerves. It's a chronic pain, often described as a burning or raw feeling right at the entrance of the vagina. With this one, the nerves have become hypersensitive, and even the lightest touch can be really painful. So let's really compare how these two feel, because it's so distinct. With vaginismus, the muscle issue, you might feel like you're hitting a wall. The pain is from that internal tightness during insertion. But with vestibulodynia, the nerve issue, it's more of a stinging or raw pain right at the entrance. And get this, it can hurt during both insertion and removal. See the difference? Understanding which one sounds more like you is a huge clue. Now, you're probably wondering, where is all this amazing, specialized information coming from? Well, it's super important to know who the expert is that's guiding us through this. Every insight we're sharing today comes from the incredible clinical work of Dr. Farzana from the Women's Health Clinic. She's a specialist who deals with exactly these kinds of issues every single day. And when we say expert, we mean it. Dr. Khan has over 2 decades of medical experience. She got her MD way back in 2003, then specialized in obstetrics and gynecology, and even got a diploma in sexual and reproductive health. And today, she's actually training other doctors in the field. That's how respected she is. Her clinical practice is laser-focused on things like vaginal health and sexual function. She's also a leader in her field, training other clinicians. And what's really cool is her approach. She's all about giving clear explanations and making sure patients are part of the decision-making process. Okay, so we understand the potential causes, we know the expert guiding us. Now for what you've really been waiting for, the most important part. What can you actually do about it? Let's talk about your path to relief. Because yes, there is one. But first, let's just bust a huge myth right now. That little voice that might be telling you to just push through it. Well, Dr. Khan and her clinic say absolutely not. Pain is your body's alarm system. It's a protective signal, and its whole job is to get you to listen. So what does listening to your body actually look like? Well, here are some practical first steps from the Women's Health Clinic that you can try. First, maybe switch to pads or a menstrual cup for a bit to give your body a break from that pain cycle. Always use a good water-based lubricant. Try some deep belly breathing to relax your muscles before you even start. And hey, don't be afraid to try different positions, maybe with one leg up or lying down. Now, if you've tried all that and you're still struggling, please know that there are fantastic medical options. For vaginismus, pelvic floor physiotherapy is considered the gold standard treatment. For vestibulodynia, there are topical creams that can make a world of difference. There's also therapy to help break that fear-pain cycle, and simple tests a doctor can do to really pinpoint the cause. Okay, we're almost done, but this last part is critical. While the conditions we've talked about are definitely treatable, some symptoms can be signs of something more serious. We need to talk about when it's time to seek help urgently. So please, pay close attention to these red flags. If you have any heavy or unexpected bleeding, any signs of infection like a foul-smelling discharge or a fever, any new lumps or skin changes you can see, or a sudden really bad pain that's not related to your period, you need to see a doctor right away. Don't wait. So, when you boil it all down, what's the big takeaway here? It's that tampon pain is not normal. It's not something to endure. It's a message. It's a valuable early warning sign that something deserves your attention. Which brings us to our final question for you. Your body is sending a signal. Are you ready to listen?